Project is regarding housing insecurity as a social determinant of health. And I did my service hours through the Iowa Valley Habitat for Humanity, which primarily services the Johnson County area and also surrounding counties. Habitat for Humanity's mission and population. I think most people have a basic idea of what Habitat for Humanity does. Their mission statement's up there on the right, seeking to put God's love into action. Habitat for Humanity brings people together to build homes, communities, and hope. In practice, it's providing affordable housing to families in need. Their definition of affordable is such that no more than 30% of the family income is spent on housing and utilities. The criteria for applicants is that they have to be permanent residents and they have to fall into an income bracket of 40 to 80% of the median income in the county. In Johnson County, for a family of four, that's $47,000 to, I believe, $94,000 a year. Recipients of homes, before they receive the home, have to put in community service and what they call sweat equity hours, the organization, where they work on building the homes that they and similar families are going to move into. Prioritizing for these homes is given to those with the lowest income and greatest need that fall within the criteria for applications, which is not given regard to race, religion, nationality, or sex. Some background facts on housing insecurity is the federal government's definition is those who spend more than 30% of their monthly income on housing and utilities. Some organizations use a higher amount, such as 50% of monthly income on housing and utilities. And I don't think that waters down the importance of the 30% definition that the federal government uses, but rather it highlights that there's some segments of the population that are extremely housing insecure. You can see with the table taken from U.S. Census Bureau data that this primarily affects those of lesser means, with over 50% of those making under $50,000 a year being housing insecure versus just 10% of those making above $75,000. This works out to over a third of the population being housing insecure. Healthy People 2030 set a target of 25.5% being housing insecure by the end of this decade. And the number of those being housing insecure has actually risen since they set that goal. So we're backsliding on it a little bit as a country. Habitat for Humanity serves some intersecting vulnerable populations that have negative social determinants of health. The man I was working with at Habitat that day, I believe he's from Sudan. He's an immigrant. He has kids in the U.S. And if you look on their website, just at 7 feature families, all of them are immigrants from Sudan or the Congo. All are ethnic minorities and all have children born in the U.S. And I think children is a big intersecting vulnerable population to focus on when we talk about housing insecurity, because much of the research on the negative health outcomes are focused on the negative health outcomes of children who are growing up in housing insecure environments. These are some of the characteristics of the experiences of those who are housing insecure. They often have multiple moves within a year. They live in crowded conditions, which is defined as multiple people sleeping to one bedroom. And there's a large percentage of them that are behind on their monthly payments for their home. And you can see the associations of these things: increased childhood obesity, neurocognitive issues and erratic follow-up and care for moving multiple times, associations with low birth weight for those behind on their monthly payments and living in crowded visits, in crowded conditions, and more ED visits as well. There's also some miscellaneous associations of those experiencing housing insecurity, such as worsened asthma outcomes, worsened albuminuria and CKD. What's interesting about that study by Novick 2020 is that albuminuria was worse, but the progression of CKD was the same for those housing insecure and not. Diabetics who are housing insecure in general have worse follow-up care, including PCP visits, flu shots, eye exams, and physical activity. Uh, what is interesting is they happen to experience more foot exams. Uh, the explanation for that is that many of these people go to sliding scale clinics to receive their health care, and foot exams are almost a cornerstone of diabetic care at those establishments. Marsal 2023 found a large correlation with housing insecurity and decreased employment stability for working mothers. And that you can really see how that can have knock-on effects for the entire family uh, if one of the principal earners or the only earner in the family can't have a stable job. There's limitations to this data, and firstly is that all of it's associative and none of it is causal. And there's just no ethical way to prove causality with negative health outcomes and people spending more than what they have able to spend on their homes. Uh, and it's also difficult to separate confounding factors of these things. So if we look at worse asthma outcomes as association for housing insecurity, sometimes it's that people are buying homes in areas where it's cheaper to live to make their money go farther. But with that, they're more polluted areas, so asthma outcomes are worse. And then people go to the ED more, or they're moving around frequently to afford rent, so they have worse follow-up care. So they have more asthma exacerbations and more ED admissions for asthma. And I don't think this shows that housing insecurity maybe isn't as big of a problem as this data points it out to be, but rather it shows how housing insecurity dovetails with a lot of other social and environmental um, determinants of health. And the final limitation to this data is that most of it focuses on urban populations rather than in rural and suburban areas. So it might not be as generalizable to Iowa as it would be to California or Florida. Practice implications. The principal practice implication is that there's a need for further research and guidelines. Currently, the Preventative Services Task Force has no guidelines regarding screening for housing insecurity. There's many tools that exist, but none are well studied enough to be validated or predict outcomes of housing insecurity. In that meta-analysis by Ader 2021, I believe something like 60 tools were examined, and there's just not the data behind any of them to be well validated. And this obviously leads to the next problem where not very many people are using these tools because they're not validated. So only a quarter of physician offices use these screening tools and 60% of hospitals do. So what we need is validation of those screening tools, which will hopefully lead to increased uptake of the screening tools by practices so that we can start to affect change in these people's lives. And we need public policy changes to address housing insecurity on a societal level. Healthy People 2030 is trying to do that, but we're backsliding. Here are my works cited, and here's my contact information if you have any questions.